Hello guys, today I would like to bring to your notice about kind of unfavorable baldness. I mean to say it's not the typical baldness, unfavorable type of baldness. The baldness pattern is not determined nicely, and that kind of patient, what are the plans we're going to do? What customization we need to do? I would say in simpler terms, this is a kind of a difficult case for amateur surgeons. Really wanted to show you that kind of patients with a treatment plan and results. Kindly watch the video until end to understand what kind of plan we did and achieved best outcome for this patient. Most of the cases usually will not be typical baldness. Usually when we study about textbooks about transplantation or when we go for training, usually they would show kind of a typical baldness pattern cases and typical modality of treatments. That sounds so easy for us while learning. But when you come to the realistic picture, you would not get that kind of cases in a day-by-day basis. You would always get each patient is a different scenarios. This is one kind of a such patient, I can say, difficult surgery for beginners. Well, what makes us difficult here is the kind of a diffuse pattern combined with male pattern baldness, or I can say it's unfavorable pattern of the baldness. The baldness is not distinctly defined. It's kind of spreading everywhere. There is a few hairs in the frontal area. There is no hair in the back. There is some hair in the kind of mid scalp. Well, if this patient age is around 46 years, then there's no need to wait further more years to go bald. That's another scenario we need to take into consideration. This case actually, if you do a typical kind of implantation, you would not get any results because kind of a meticulous tailored plan is necessary to get better achievement. So let us see how we planned it and how we achieved good camouflage in this patient. Most of the cases we already discussed about implanting total number of the grafts or implanting more number of the grafts does not give you results for you. It's a kind of artistic style, tailored plan, customized plan to each patient brings you a better outcome. So by looking at this patient, I basically understood he's going to come from left to right. Kind of it's not silky, neither curly, kind of wavy hair. He has it. Kind of a best donor. Baldness is extended not only from the hairline, kind of mid scalp, and even in the crown area, there's more baldness is projected. So patient obviously has kind of expectations both front, back, and even crown area. That's where the tricky point is. So well, this case we cannot plan in single session. But well, of course, if you really want to plan in single session, what are the tailored plan we're going to implement in this case is we are sure that we need to get hairline design so that someone looks at it in the frontal view is supposed to look better. So we made frontal hairline, and especially left side when you think about it, because it's coming from left to right, we need to get more density so that left lateral view after the transplantation is supposed to be very neat and manageably covered area. Otherwise, you will be bald in the backside area. It doesn't look natural. So plan is getting the hairline and left lateral side implanting more density and considerably less amount of density in the crown area. Why? Because if you leave the crown open, that looks really awkward for him for second session. I don't think he's going to get a kind of applausible results in the first session. So rather wasting the grafts in the mid scalp, we made a tailored plan to this patient, making hairline and lateral side and little in the crown area. So that's the plan for session 1. Probably session 2, we can add more grafts in the crown area, a little more density in the mid scalp, depending on the patient needs. And that's the plan we did for this patient. Surgery went very well. If you can see the results after 9 months, kind of impeccable results, mind-blowing kind of outcome from the frontal view and density in the mid scalp. And the plan, actually we did not implant more in the mid scalp. There's a plan we did because of that plan. He has got good coverage in the hairline, left lateral side, and in the crown also. I'm sure crown density is definitely less. These kind of patients has to go for the second session in the crown, and then only you would get more density in the crown. But well, for the photos, in reality, that looks more than better than photos and pictures. So immediate impression, someone is looking at him immediately, a glimpse of looking at the front and lateral view, he looks so young. That's because of the tailored plan we did for him. I still preserved a lot many more grafts for future sessions. Hope we're going to plan second session sooner or later with his permission. Whenever you really want to get it done, you can get it done second session. Here, a noted point is this: in this first plan, we made such a way that second session would be optional, not mandatory. Suppose if you don't implant some grafts in the crown area during the first session, I'm sure he's supposed to go for second session mandatorily. So we made such a way that tailored plan for him, second session would be optional. So with one session also, you can just get rid of these normal things and keep move on with existing hair and style it. So well, whenever you want second session in the future, not immediately after transplantation, 1 year, 2 years, 5 years, 10 years down the line, you can think about doing second session. So we are done plan like that during the implantation time, as well as even in the harvestation area, we also preserved more grafts. That is the intelligent plan for this kind of patients, one should understand. This is on a typical patient to show how a challenging case and difficult case would be. Usually, most of the doctors just plan some hair in the crown or in the frontal area without having any idea about future transplants, without having any idea about the patient hairstyle, patient age. Then they would end up in getting some bunch of hair in the frontal area where complete crown will be open, or bunch of hair in the crown where front side or left lateral side will be completely open. Gives them kind of a incomplete hair transplant results. That's the reason you should always choose go for the best and artistic surgeon who has aesthetic sense to think about how this future transplant is going to be and what are the precautions that one should take to do or encourage for in the second session. So then you're supposed to even leave some graft left in the backside. So all this really matters to get your transplant results. And not only graft number can make you good results, not only techniques can make you good results, it's all the artistic and tailored plan to each patient will definitely brings you a plausible and best outcome. Thank you.